No problem.
All right. Welcome to week 8. Hard to believe we've been doing this for about 2 months of our regional report out calls around COVID and the regional response and what's going on with your healthcare system. This is the Southeast Kansas region, 4:30 on Tuesdays. We've been here 8 weeks in a row. With trends going in the right direction, state leadership's agreed to move this to every other week. And so our next one will not be next week. It will be February 16th and then March 2nd after that. So I highly recommend you go to the website covid.ks.gov/report-outs, covid.ks.gov/report-outs, and sign up. All you have to do is put in your email and check the box for Southeast Kansas, and you'll get an email as soon as this thing's over with the dashboard, with a link to this call, and you can catch up what's going on. We'll let you know what's going on with case counts, with your hospital system, with public health, and with the vaccine rollout. And we're trying to get these to be a little shorter and a little more consumable for you. So there you go. Happy Groundhog's Day, February 2nd. Unfortunately, 6 more weeks of winter. Groundhog saw a shadow this morning. But other than that, the news is going to get better from here. Let me share the screen and let's look at our dashboard and you can see what's going on here. So here we are, Southeast Kansas, February 2nd. You'll see of the hospitals reporting, we have 2 out of the 10 that are still anticipating critical staffing shortages this week. That's been getting better across the state and better here in Southeast Kansas, but still there's issues with people needing to be out with either kids or themselves getting COVID or quarantine. And there's a lot of people just dealing with massive fatigue from having to work long hours and cover more shifts, and mental health is a real issue right now that I know people are watching. So I'm going to move over here to hospitalized, confirmed or suspected COVID patients for the Southeast region. We're showing 16. And last week that number was 40. 3 weeks ago that number was 55. So we're trending in the right direction. Number of suspected COVID ICU patients, that's at 8. It was at 8 last week, 17 the week before that. And adult staffed ICU beds available, 13, which is about where it was last week, and 41% available. When we're looking at this, what I've been hearing pretty consistently around the state from hospitals is that they're generally around 40 or 50% of the COVID patient count from where they were at the peak in December. And so that's good to hear. Look at the story here, 4 weeks in a row, or 5 weeks in a row, really, where we've had a decrease in case counts in Southeast Kansas. That's good to see with 538. The positivity rate, again, in the 7 to 8% range, 7.14% for Southeast Kansas. And, as a state, our numbers are at 6.44% positivity rate, which is the lowest since September. So we're seeing some good news. I'm going to flip over to the vaccine website. We've looked at this before. This is kansasvaccine.gov, put together by KDHE. They're going to roll out the Find My Vaccine site here tomorrow, but we're going to focus on data. If you click on data, you come, this number here, percent of Kansas vaccinated. This was at 4.5% last week, now 6.4%. We know that our numbers are still actually lagging because of problems with the WebIZ portal. But you can see first doses, second doses, 185,000 plus Kansans have gotten that first dose, which is good. Also added here this week that wasn't here last week is the federal LTC program. That's long-term care. This is contracted with Walgreens and CVS. And what I heard Secretary Norman say this morning was that we've gotten through 3/4 of the long-term care patients with the vaccine, and they're hoping that they'll have everybody by the end of the second week. So obviously it's a very vulnerable population to the coronavirus, and glad to see them working through that. So you can see that also now registering in on our on what's going on with our state. Just flipping through this, you can see again who's been vaccinated with what, what's going on. You can see kind of the cycles. The vaccine comes into the state, and what I really want to hammer home for everybody is the issues with the vaccine are supply side. We have 800,000 people in the state that qualify in phase 2, and we're getting about 50,000 vaccines a week, and that may go up to 60,000, which is quite an increase if that happens. But it takes a long time to get 800,000 people 2 shots when you're only getting 50 to 60,000 a week. I think counties and hospitals are really partnering well together. We'll hear more from Destiny and Bruce here in a minute on that. But generally, the goal is inside of a week to have those shots in arms when they arrive. A lot of places are getting it done inside 2 or 3 days. You can see vaccines arrive, they get them out, wait for the next set to arrive, they get them out, wait for the next set. So that's kind of the rhythm you're seeing here on this chart. And so just want to make sure, as people are frustrated, it's not that they have a lot of vaccine sitting around and they can't distribute it or get in arms. It's just we don't have a lot of vaccine around. Also, just helpful for people, every week they're putting up the number of doses distributed by county. A lot of rural counties are getting 100. This is all done by population. Neosho, which is in Southeast, there are 200. Wilson, you're 100. So it's done by population base, but one of the things that it should be getting better is federal government's going to start forecasting by 3 weeks. Right now, we only know by 1 week, if we're lucky, what's coming, and this will help everybody as they're planning and getting their lists together. So there you go. Those are the dashboards and the numbers, but let's hear from the people on the ground making this all come to life, and pass it over to Destiny Wheeler there in Wilson County to tell us what's going on from her perspective.
Yeah, thanks, John. Like you said, I'm Destiny Wheeler with the Wilson County Health Department here in Southeast Kansas. And that graph just really hits the nail on the head. We get it one day, we give it all that week to the best of our ability, and we aren't just sitting on hordes of vaccine here. We're definitely getting it all out within the week that we get it. Personally, our health department is doing 1 vaccine clinic a week on Thursdays, and we are, it doesn't take long to get rid of 100 doses in a county, I can tell you. So we are, all of us in every county in the state, having to prioritize those groups. And I know we've talked about that before. It's going to look a little bit different in every county, and so far it seems to be going pretty well. Not a lot of adverse reactions or anything like that. We haven't had any sore arms, but that's maybe feeling a little crummy the next day, but that's pretty much all. We are really excited that our long-term care facilities are getting vaccinated staff and residents. That is fantastic, and it's something that we've all been really excited to happen for a long time now. So really excited about that. Really, the story is just, we need vaccine to get into people. Every county is doing wait lists. Like I say, how they prioritize everyone's a little different per county, because not everything's one size fits all. But some are doing drive-through clinics, some are doing walk-through clinics. Everyone, to the best of my knowledge, is scheduling, because we do have to give these in cohorts of 10. So the vaccine comes in 10 dose vials, and we have to give them 10 at a time. So we're living our live 10 doses at a time right now. So that's basically what we're doing, and kind of what we're up against right now.
Thank you. And how are you guys prioritizing in your county, just as an example? Is it by age or occupation?
Oh, we're trying to do both. We're really trying to keep it as even as we can between the aging population and the most exposed population. So out of our allotment of 100, we're trying to make it as close to 50-50 as we can. In our county right now, we're prioritizing people 85 and older in the age group, but I think as of next week we can drop that to 75 and older. We're kind of working through those together. So yeah, we should be down to 75 and older, and most of our county employees, and we're working on schools too. We're working on grocery stores and congregate living settings, and those really high exposure jobs where people are just kind of dangling out there and don't have a lot of protection. Those are the people that we're trying to spend the other half. So the most vulnerable and the most exposed is who we're trying to hit as close as we can to 50-50.
Okay. Yeah, I know, like in Wichita and Sedgwick County, we're at 80 and above right now, as we're working through the age thing. So every county is taking their own approach. Really encourage you to check out your county health department website or Facebook page to see how they're prioritizing, how you can get on a wait list, and where you'll fit in on that. So thank you, Destiny. Appreciate that. Anything else before I pass it to Bruce?
Not really. The only other thing that I've heard through the region and kind of through the state is that some smaller health departments are getting calls saying that from people that are in big cities saying that because we don't have as many people, we're working through our phases more quickly. And so they're being encouraged to call smaller health departments. And I just would like to remind everybody that's not necessarily true. We do have many less people, but we have many less shots too. So so they're probably going to be prioritized by the county that you live and work in most cases. So
Great. Thank you. Yeah, I think that's important information for people to have because, it comes to Kansas as we're 1% of the country's population. So we're getting 1% of the shots. And the most dominant filter in the algorithm that the state's using is population based as they're doling out the shots. And so, theoretically, we should be working through phase 2 in the same rhythm all across all the counties, based on what people are getting based on the percent of their population. So thanks for pointing that out, Destiny. Let's pass it over to Bruce.
Hey, Bruce Witt, Chief Advocacy Officer for Ascension Via Christi in Kansas. So Drew at the hospital provided me some kind of numbers from the Pittsburgh area. So we have vaccinated, or I guess provided 999 doses. Kind of surprised we can find one more to get to 1,000, but 999 doses of the vaccine, and 421 of those actually have received their second doses. So we're kind of halfway through getting everybody their second dose, and our vaccine clinic will be kind of shut down in the hospital on March 1st. And then from that point on, everything will be administered by the Crawford County Health Department in Pittsburgh and the local FQHC. And then, as Drew pointed out, the Crawford County Health Department does have a plan to vaccinate up to 9,000 people a week, obviously depending on when the amount of vaccines they can acquire. So they can do up to 9,000 if they have the vaccines to do it. We are down in our hospital down to 8 inpatients. We were well into the 20s in Pittsburgh, not too long ago. So numbers are going down, positivity rate is going down, but that's kind of where we're at least in Pittsburgh.
Thanks, Bruce. Do you know, so there are some places where the hospital system's partnering with the counties. Do you know if any of the counties in the Southeast region are partnering with hospitals, or is that?
I haven't talked to some of the other hospitals. I know in Pittsburgh, we've had conversations with the county, but right now with their plan that they have in place, that it doesn't appear that they will need us to assist in as far as setting up a clinic. We may send them some volunteers to help administer vaccines if they need them. But that's kind of where we're at in the Crawford County area, at least.
Generally hearing really good cooperation out there, as there has been through this whole thing.
Right.
You guys are all in the trenches together. So that's good. I'll throw up here on the screen too. We've had Dr. Watson with us from Cheyenne Mountain Software at different points, and he was able to be on the first couple of calls today. Here's this hospital capacity for transfers. We've looked at this just a couple of weeks ago. Most of it was red. Now we're seeing more yellow and green with just a little bit of red. And so he was saying transfer times, at one point, COVID patients were taking 4 hours to find a hospital bed and a transfer. Now that's down to an hour and a half on average, and non-COVID an hour. So that's good. And I think I saw Destiny drink out of a Green Bay Packers cup. And so she's liking the green and yellow. Most people probably with the Chiefs, don't want to see red on this screen, but they'll take red on other screens. So that's also good news out there to see the transfers opening up. So cases are going down, hospital capacity is opening up a little bit again, which is good to see. And we're getting people vaccinated. Again, a race, really before you get a more contagious variant to become the dominant variant in this region, we're trying to take care of that vulnerable population. And that's what it's all about. So anything, Bruce, Destiny, you'd like to add before I wrap it up?
Oh, no, I think I've maybe stated something similar on a previous call. The numbers are looking really good, but as we all know, there's some variants out there with the virus. And, I think we want people to continue to be diligent on, wearing masks and social distancing and doing all those things. We're making a lot of progress. We have a long way to go.
Yep, I agree, Bruce. It's an important point to bring home. Particularly with the Super Bowl this weekend, cheering on the Chiefs. I've shared on a couple other calls, not everybody knows the story, but last year they actually credited the Chiefs with saving lives because the coronavirus was already going around San Francisco. And had San Francisco won the Super Bowl, they would have held a parade and it would have been a super spreader event because it wasn't in Kansas yet. So let's help the Chiefs keep saving lives this week by being smart about how we watch the game and cheer. Ventilation's important, not being in a big group. Because I imagine you want to cheer, stand up, yell for Mahomes as we cheer him on to victory. And Destiny, we're counting on you to get behind the Chiefs, right?
My husband's a Chiefs guy. They're my second team.
Okay, good. I'm going to share a couple bright spots here before we go away. This has been my favorite. We heard it in Northeast Kansas, but I think it'll resonate for everybody. They were doing a vaccine clinic at the VA hospital in Topeka, and a lot of folks that were born before around World War II, they asked them to all write on there why they chose to get the virus. And let me pull up. I have written down a lot of the reasons that they gave here. For me, my family, and the veterans that we serve, because COVID stinks, with an exclamation point. I'll agree on that. For my 91-year-old father, to keep him safe. Marines lead the way, but you can see some of them up here on the screen. So it's just important, as these, we have a supply side issue, like I said, we're getting to those most vulnerable, but it's great to see us getting to the people who've served our country and all of us in this way. And then been sharing too with the Super Bowl. I was just looking, lower bowl tickets, $15,000 to $30,000 a piece. It's limited capacity, but the NFL has given 7,500 tickets to frontline workers who've been vaccinated, and several of them from Kansas be cheering on the Chiefs. Was reading about one of the nurses from Hayes. Just love the spirit of some of these frontline workers. She'd been selected, never been to a beach, never been on an airplane. Gonna be quite a weekend for her. But she said, it's been hard for me to accept the ticket because I know there are so many people, nurses and healthcare providers, that have put in so much work. It's hard for me to feel deserving of this. There's so many heroes out there. I want to thank you two, Destiny and Bruce, for all that you've been doing, for choosing and being willing to give your time to be on these calls. Very, very grateful for that. And the way you serve your region and you serve your areas and your hospitals and your county and all that. So thank you all for what you're doing. Again, 2 weeks from now, we'll be back. Go on and sign on up on our website to receive the email. But February 16th, we'll be back here to tell you what's going on and have a vaccine update for you. And we'll look forward to seeing you then. Bruce, Destiny, thank you very much and have a great week.
Thank you.